An ounce of prevention is worth a pound of cure. It's an age-old adage, but it represents a new paradigm in health care. There's more emphasis today on methods to preserve and maintain our health and well-being. From diet to lifestyle, we're becoming increasingly aware of what we can do to help ourselves.
Located in Milwaukee, Wisconsin Bariatrics is recognized as an American Society of Bariatric Surgery Center of Excellence. Medical Director Dr. Thomas Chua's involvement with bariatric surgery dates back to 1975. Along the way, Dr. Chua has performed more than 3,000 gastric bypass and 700 adjustable gastric band procedures on thousands of patients looking to lead longer, healthier lives.
When they're extremely obese, it interferes with their quality of life, their health, and we know that majority of these patients undergoing bariatric surgery, those illnesses do go away, such as diabetes, high blood pressure, high cholesterol, sleep apnea, joint problems, urinary incontinence, depression. I have some patients where they were blind from being extremely obese, and after bariatric surgery, those eyesights come back. And these are very gratifying for me as a bariatric surgeon, that I can improve their quality of life.
Lois Winkle knew she had to do something about her weight before it took its toll on her health.
I never was really happy with the way that I looked, and I was never really socially comfortable. I didn't feel good about myself. My self-esteem was very low, and also my self-worth. I didn't feel like I was a valuable person to anyone, including to my husband and family. I had exhausted all of my options. I've tried every diet imaginable, and I needed something that was going to be permanent.
Lois opted for weight loss surgery, turning to the skilled hands of Dr. Thomas Chua and the talented staff with Wisconsin Bariatrics. Dr. Chua is a pioneer in the field of bariatric surgery and regularly performs minimally invasive adjustable gastric band and gastric bypass procedures on his patients with excellent results.
Each patient are different from each other, and we do tailor the needs of the patients. Depends on their medical history, their family history. We offer gastric bypass, the vertical band, the lap band, or adjustable gastric banding, and to suit what's best for the patient. The adjustable gastric banding is placed under general anesthesia. We place a band around the top part of the stomach, and we buckle it, and there's a port that's attached to this band, and we place this port underneath the skin. The adjustable gastric banding is the safest of all of the bariatric procedures. And it does control portions, so people with portion control problems, this would work well. When the time comes for their adjustment, they would come in the office, and under local anesthesia, we put a needle into this port and gradually tighten the band. They need to come back on a frequent basis, sometimes every month, every 3 months, for us to do the adjustments. Gastric bypass is also done under general anesthesia, and typically takes about 2 hours to do. They're in the hospital maybe 1 or 2 nights, and their weight loss is slightly faster than the banding procedures. Gastric bypass works the best for people who have bad reflux and high cholesterol, because it brings their cholesterol down really well. I did the first vertical band in the country, and I helped develop the technique for the procedure. And it is also another restrictive procedure for portion control problem for the patients wherein they eat big. And with this surgery, they also will have limited intake, and thus their weight loss. The vertical band is not adjustable, so it's more permanent, and they don't have to come back for adjustments.
Understanding that treating obesity encompasses the patient's physical, emotional, and psychological needs, Dr. Chua and his staff are dedicated to the patient's total care and well-being before, during, and after surgery.
We're here from the beginning until the end. These steps are complex, and it involves dietitian, psychologist, and all the specialists that's involved in the care of your health.
Now, Lois takes it one day at a time, keeping her promise to eat right and exercise and never let her weight get in the way again.
Dr. Chua performed the vertical band. It's a non-adjustable band. I have since lost almost 140 pounds and I feel fantastic. I'm a whole new person. I would absolutely refer anyone to Dr. Chua. My experience has been fantastic. His staff has been terrific in every aspect. From the start of seeing the dietitian, the psychologist, everyone was so incredibly helpful and very, very supportive and really walked me through quite a trying time in my life and educated me, prepared me in every aspect of it, and there were no surprises when I came out of surgery. I felt totally prepared to start my new life.
It is very gratifying to be part of these patients' lives wherein I am changing their life, and I get hugs and people just are very happy, and they include me in their lives. They tell me how well they're doing and that I've saved their lives, and those are heavy words.
I've been struggling with my weight since I've been in kindergarten. My thought was to get this weight problem taken care of. I'm diabetic. My father passed away when he was 58, and I knew I was headed down the same path, so that's why I decided to do this. I've lost 200 pounds. I had the lap band put on, and it's been very good to me, very good. Dr. Chua has been a lifesaver for me, and that's a fact. His staff and him are very knowledgeable in what they did and what they did to me. I have nothing but praise for them. I would recommend them highly. I did a lot of educated material on the web and looked at all my options before I chose him as a surgeon, and I have not been sorry. I'm just glad that I had it done because my family is most important to me, and if I was afraid that I wouldn't be around to have much more time the way I was going, being so heavy, I just am glad I did it for them and for myself.
I started out walking, and I walk and bike with my sister-in-law, and now I run races. I've done 5Ks, 10Ks, triathlons, duathlons, and going to be doing a half marathon and hopefully a full marathon. The best part is feeling comfortable with myself, feeling happy to be healthy, feeling like I socially fit in, not being in pain anymore, and being able to fulfill my job and my duties, and to be a good wife and to be a good stepmom. You hear the whispers, "Oh my gosh, that was Lois," and they don't recognize me 140 pounds thinner. It's fun to hear that and to see how people react to me, and really people have changed their reaction to me. You get a more serious approach from people, and people are more accepting of me, and it's very neat that way.
Wisconsin Bariatrics also offer tummy tucks, arm and thigh reductions. We also have a Medi-Spa that also can improve their beauty. With a laser machine, we can get rid of some of the skin discolorations and wrinkles, and also Botox and fillers. Wisconsin Bariatrics is an office that's filled with people that care, and we would like to help these patients to help improve their health and make them have a better quality of life. We'd like to invite you to come to our free seminar and check out what would work best for you. If you're considering bariatric surgery, Wisconsin Bariatrics is here to help you succeed to live a healthier and better life.
New beginnings are possible. Call Wisconsin Bariatrics or log on to their website to see if weight loss surgery is right for you. It may be your first step toward making your life your choice.
We hope this program has been an inspiration to you and all you hope to achieve. Be sure to join us next time as we continue to profile the people and ideas changing the way we live. I'm Lou Gossett Jr.
For more information, call 414-281-9665.